Thank you and good morning. Kate made a statement about HR being the last to know about a labor issue. Normally on Friday mornings I spend my mornings at an executive staff meeting arguing with other executives who don't necessarily see HR as a priority. So it is great to be in a room full of HR people who actually appreciate HR. So let me tell you a little bit about MetroPlus. MetroPlus is a Medicaid and Medicare managed care company that manages the health care of the poorest and most vulnerable men, women, and children in New York City. Our mission is to provide our members with access to the highest quality, cost-effective health care, including a comprehensive program of care management, health education, and customer services. Over my life, throughout my career, I have enrolled in schools and worked for companies who claim that they commit to diversity. But it wasn't until I got to MetroPlus that I saw real corporate and cultural diversity. So if you line up all of the senior staff at MetroPlus, you'd see Black, white, Asian, Latino, Asian Pacific, Asian South Pacific, Middle Eastern, straight, gay, young, old, male, female, the whole mosaic that former Mayor David Dinkins used to refer to. Our staff speaks over 75 different languages, and we're not even a global company. We only operate in New York City. MetroPlus operates like a family. We're very tolerant, we're very understanding, very flexible, very loving. Don't get me wrong, we're not without our corporate politics and we're far from perfect, but it's an amazing place to work. And the people who work for MetroPlus work there because we truly care about the people that we serve. And we don't just say that we care, we actually walk the talk. 6 of the last 7 years, we've been ranked #1 in New York City in our industry for quality and customer satisfaction based on Department of Health indicators. And this past year, we were actually ranked #1 in all of New York State. One of the good things about having this great family-style culture with flexible schedules and sensitivity to work-life balance is that people enjoy it. So they actually stick around longer. As such, we have this really low turnover rate, and our per capita tenure continues to increase. The flip side of that is that our workforce ages and gets older, and an aging workforce presents, as we're talking about, presents some challenges. So now we find ourselves in a position where 25% of our workers are 50 years old and older. But because of our success and the success of our industry, the Department of Health gives us, and in some cases requires us, to take on more and more responsibilities, which means we keep growing and growing. And according to Martin's statistics, we're going to continue to grow even more. When I started with MetroPlus about 7 years ago, there were only about 300 employees. We had just under 200,000 members, and we had revenue somewhere in the area of $350 million a year. In 7 years, we've tripled the number of employees to over 900, doubled the membership to nearly 425,000 members, and now we bring in revenues of nearly $2 billion a year. It's almost 7 times the revenues that we brought in at the time that I started, and I'd like to take credit for that. So many of our older workers are expected to take on more and more work, learn new things, to become competent with new technologies. But as we grow, the culture has to change. It becomes less and less family-like, less and less intimate, less and less personable. So on the one hand, we have 25% of our staff that's 50 years old and older. And as an aside, we have this really great pension plan that allows you to retire at the age of as early as 55 with full benefits. But on the other hand, we have culture changes, growth, demands on employees to do additional responsibilities, introductions of new technologies, and sometimes our older workers, when faced with all of these culture changes versus the prospect of retiring at 55, a lot of them see retirement as an attractive proposition. So we're in a place where we have to respond by seeking ways to convert the individual knowledge of our aging workers into institutional memory. So as part of our succession plan, we conduct a series of interviews which we call the knowledge transfer process. Our knowledge transfer interview process is divided into sections. I'll touch on each of these sections of the knowledge transfer process and give you a few examples of the types of questions that we ask our older workers with respect to each section. And these are just a small sample of the types of questions that we ask, but I think you'll have a good idea regarding how the process works. So let's start with section 1, which is history. And that is the history that our older workers have gained about the organization during their employment. For those who've been with the organization for more than 10 years, the wealth of information that they would have would far surpass that of a person who had been with the organization for a lesser amount of time. What are some of the examples of the questions that we ask with respect to history? Well, we'll start with, what year were you hired? Who was in charge of the organization when you were hired? How many employees did the organization have when you were hired? Can you recall the sales revenues at the time you were hired? How would you describe the organizational culture at the time you were hired? Quick story about that question. Describe the organizational culture at the time you were hired. Just the other day, we were discussing our expansion, and we recently leased 2 additional floors in our Water Street location, which brings us to about 10 floors over 2 buildings. And because of the expansion, all of the executive staff is jockeying for more space, bigger offices, et cetera. And the meeting got really heated, so much so that the chief medical officer, who's this really, really big guy, in the heat of the discussion, he said, "You guys are getting me mad, and I'm going to clock somebody." And he shook his fist in the air. Now, I know what you're thinking. Just a moment ago, I told you that MetroPlus had this loving, family-type atmosphere. Now I'm talking about the chief medical officer threatening to punch people in meetings. Well, I don't know about your family, but I grew up in the Bronx, and that's exactly how we speak to each other. But on a serious note, right after his threat, another executive staff member who was sitting next to him put her arm on his shoulder, and she said to him, "You know, wasn't it great when we only had 1 floor and we got to see everybody every day and we didn't have to deal with these issues?" You know, and every time I ask someone to describe the culture from MetroPlus from 15 or 20 years ago, they tell me that it was this mom and pop shop atmosphere. We all saw each other every day. I not only knew everybody, but I knew everybody's family. But the interesting thing about the chief medical officer's outburst was that, to me, it sort of illustrates some of the tension that we feel from the rapid growth and the fact that we're being forced to change the way that we do business. So it's that type of tension that might lead someone who has been there for 25 years and who could retire at 55 to say, you know, I've done enough with this company. I think it's time to retire because, you know, our pension plan, our older workers, for the most part, feel that they can afford to retire. So let's move on to Section 2. Section 2, we document their personal role. And it's important for persons who follow in the footsteps for our older workers to understand how they've developed in the organization. This information could assist their successor with understanding growth opportunities, relationships, duties, functions, and methods that made the incumbent successful in their position. In addition, knowing a person's personal history will assist in helping successors to understand what the position looked like from the incumbent's perspective. So examples of questions that we would ask with respect to personal role are, please list all of the positions that you've held with this organization until now and the length of time that you remained in that position. List the education requirements that you were required to have when you were hired for this position. Are those education requirements the same today for this position? Given your current knowledge of this position, what qualifications might have assisted you in performing this position initially? Also, describe the initial training that you received in this position. Now, I don't know if you remember the first day that you started with your current company. Nowadays, we have new hire orientations, all of these sophisticated blended learning, onboarding processes. But when I ask older workers what type of training they received to learn their current positions, they laugh at me. They're like, training? I was lucky if I got an ID, or, you know, they showed me how to get to the bathroom. That's, you know, stuff like that. But the answers to these questions bring out information that shows the contrast between where we are now from where we came from. Moving on to Section 3. In Section 3, we document their necessary working relationships. And regardless of what position they perform in an organization, there are a multitude of relationships that exist, some political, some social, some mandated by regulation. Some of those relationships may serve as critical alliances to the incumbent's existing position, and in order for somebody to be successful as a successor, it's important that they understand the relationship that that's required for each interaction, as well as those that the incumbent has established and the purpose for which the incumbent has established that relationship. Some examples of those questions would be, tell me the name of the person who is your immediate supervisor in your current position and the length of time this person has been your supervisor. Describe the interaction that takes place between you and your supervisor when you're assigned to a new project. Do you interact by phone? Do you interact by email? Is it in person? And tell me how long does it take for you to, how long do you spend with that person when you're discussing a new item? Moving on to Section 4. Section 4, we document decision-making. And with every position in an organization, there's a current amount of decision-making that's required. Regardless of the magnitude of the decision, any decision that they're responsible for making should be documented to assist others in understanding their responsibilities. So examples of decision-making questions are, tell me the daily decisions you're responsible for making in your current position and include the details for the purpose of each decision and list the relevance it has to the functioning of the rest of the organization. Do the same thing for weekly decisions, do the same thing for monthly decisions. List the people who have been the most instrumental in guiding your decisions. Moving on to Section 5. In Section 5, we discuss the meetings that they chair or the meetings that they're required to attend. Every employee is required to attend meetings. Some meetings are regularly scheduled, some are scheduled for ad hoc for special events, and others we attend when we're invited. So we document all of the meetings that incumbents are required to attend and whether or not the incumbent is expected to chair those meetings. So examples of the questions that we would ask with respect to meetings are list the weekly, the monthly, quarterly meetings that you attend and the purpose for each. Describe the people or corresponding positions that are typically attend those meetings. List the meetings that you think have been most effective or the meetings you think that have been least effective in helping you in your position. Lastly, in Section 6, we document processes. And there are certain key operational processes that the incumbents carry out each day, each week, or month, some of which may be documented and others that have been incorporated into their position to accomplish certain duties but are not documented. Some of our older workers are the only people to ever occupy their job in the company's history. So they are the sole proprietors of that information. No one else really knows exactly what they do. So their operational processes are critical to the success of every position, but we really seek to capture and document the processes of some of our long-term workers. Examples of those questions are, list the top 5 primary processes that you must complete to accomplish the tasks of your position. Document the details of why each process is important. List the various technology tools that you use on a daily basis. Include software programs for general purposes and those that are specific to your particular position. Now, before I close, just a note regarding whether or not our older workers oppose sharing knowledge. Because some might think that our older workers might be reluctant to share their knowledge for fear that their jobs might be at risk, and therefore there might be a tendency for them to hoard information as a way of, to ensure job security. We have fortunately not experienced any of that. To the contrary, our older workers freely share their information because for the most part, they're the people who built the company. When asked about their roles, you know, they say stuff like, this company is my baby, this is my home, and they don't want to see their baby fail or their company fall apart. So it's been our experience that our staff, particularly those who've been around for a while, are interested in preserving their legacy and making sure that what they created and what they built is left in the right hands. So what greater testament could there be to honoring their legacy than to convert their individual knowledge into institutional memory? Thanks.